Good afternoon, everyone. Thank you for joining our Using PSYCKES Clinical Summary webinar hosted by the Office of Population Health and Evaluation. So here's our webinar agenda for today. We will do a PSYCKES overview, and we will talk about what PSYCKES is, who's included in the application, what type of data is available, and then we'll go into accessing client-level data. And this section will cover different levels of access you have to client-level data, as well as ways you can enable access in the PSYCKES application. We will then shift gears to reviewing client-level details within the clinical summary. So this will be the main focus of majority of today's webinar, and it extensively covers what the clinical summary looks like and what information is displayed. We will also touch base on what a non-Medicaid clinical summary looks like, and we also have a few details we want to mention regarding different plans and documents which providers can view and upload in the clinical summary. We will then end the training webinar by providing you details on PSYCKES resources and training materials, as well as contact information of our PSYCKES help desk. All right, so let's begin with our Training with PSYCKES overview. So what is PSYCKES? PSYCKES stands for Psychiatric Clinical Knowledge Enhancement System. It is a secure and HIPAA-compliant online application for sharing Medicaid claims and encounter data and data from other state administrative databases. So our PSYCKES application is designed to support data-driven clinical decision-making, care coordination, and quality improvement. Please note that in PSYCKES, we do have ongoing data updates. So the data in the clinical summary is updated on a weekly basis, whereas the quality indicator reports are updated on a monthly basis. So we do currently have over 13 million individuals viewable in PSYCKES, and it includes individuals with any history of Medicaid-funded behavioral health diagnoses or treatment, or state psychiatric center inpatient or outpatient services, or health home outreach or enrollment. So if a recipient falls within this population, we will provide all data. We have data regarding general medical health information, behavioral health, residential, lab, pathology, and many other types. So what data is available in PSYCKES? Now we have a few different data sources feeding into our application. Our clinical summary provides 5 years and beyond worth of data, and again, it's updated on a weekly basis. Our biggest data source that we have is Medicaid billing. So all Medicaid fee-for-service claims and managed care encounter data is coming into our application across treatment settings. I do want to mention that with Medicaid billing data source, there is a bit of a lag from time the service occurs to the time it shows up in the application. For example, something like medications. We consider those a little bit quicker with a quicker turnaround time from the time that the medication's picked up to the time it shows in PSYCKES, and it could be as short as 2 weeks. But things like outpatient and inpatient services, it can take a couple of months from the time the service occurred to when it shows in our application. And that's why we have our other data source set. So it's our state administrative databases as listed on the screen. And these are more real time with a 0 to 7 day lag here. I will mention a few here today. So we have New York City Correctional Health Services. So if somebody spent some time in jail-based care setting, we will have that data in our application. We also have Department of Homeless Services data for New York City, health home enrollment and CMA provider information from DOH MAP. We have the name and the contact information for the health home in our application. So if somebody spent some time in a state psychiatric center, we have state PC EMR data feeding into PSYCKES. We have AOT Act information, residential and adult housing program information coming from CARES, and then suicide attempt information. We have that coming from NIMERS, and that is all available data. So even if a suicide attempt occurred 15 or 20 years ago, that would still show in our application. And then we also have safety plans, screenings, and assessments that can be entered in by you as the provider into the application through PSYCKES My Choice. Then lastly, we have intensive mobile treatment AOT referral under investigation and our another data source that is mobile crisis team information coming in from DOH, MH, Maven. So in the past few slides, I mentioned quality indicators several times. So what exactly are these quality indicators, also known as quality flags? So, OMH has identified a number of health conditions or treatment issues that are quite important. And what PSYCKES does is that it tracks clients who are positive for one or more of these health conditions or treatment issues. This way, the provider, the managed care plan, local county or state government leadership can be made aware and take necessary steps. These flags can assist with supporting clinical review as well as quality improvement. Another thing I want to mention in regards to these quality indicators is that we also provide the information as aggregate data, which allows you to view the prevalence rates at the program level, at the agency level, managed care by region or state. So you can peek at these prevalence rates and compare them to identify opportunities for improvement. So here we have some examples of our quality indicators, such as the no diabetes monitoring for individuals with diabetes and schizophrenia. Another one is low medication adherence for individuals with schizophrenia. We also have flags for high utilization of inpatient or emergency room services. And then we have our performance tracking indicators, and this comes from the New York State Department of Health. These indicator sets include many of the substance use disorder quality measures. So while the PSYCKES quality improvement report is updated on a monthly basis, DOH calculates these performance tracking indicator sets after a 6+ month billing data maturation period to allow for service invoicing. When you navigate to My QI Reports tab in PSYCKES, the as of date reflects the most recent performance tracking data run by DOH, and these measures are based on a 12-month period of service. So in the PSYCKES introductory slides, I mentioned wide variety of data that feeds into the PSYCKES application. So all of this data is available in the application in different types of reports. Firstly, we have the individual client level reports, and this is the clinical summary, which we will cover in great detail shortly. This is the Medicaid and state administrative databases treatment history and provides up to 5 years worth of data and beyond for some data elements. We then have our provider level reports, and there are four different types of this report. We have the MyQI reports, which you've heard me mention in the previous slide. Here you can review the names of the clients who are flagged for a health condition or treatment issue. If you are a provider level user, you would enable access to get information for that specific recipient. Similarly, for a recipient search, you can run ad hoc reports to identify cohorts of interest. You can take a look at a list of recipients in different advanced views that will provide additional information columns that you may be interested in. If you have provider level access, this is where access would need to be enabled to get the view of the clinical summary. Moving on to usage reports, this is used to monitor PHI access by staff. So when you go to usage tab in PSYCKES, you can see which team member from your facility has viewed a client's clinical summary or has enabled access. Next, we have our utilization reports, and this is to support providers that have value-based payment data needs. And lastly, we have our statewide reports, and this is quite similar to my QI report. Through statewide reports, you can look up a quality indicator and review statewide proportions by provider location, client location, whether that be through county or region. You can also pull proportions based on network and provider. To mention, these are at the aggregate level. All right, so now that we briefly know about the PSYCKES application and some of the data that is included in there, let's briefly talk about how to access this client level data in PSYCKES. Now, before hopping right on to enabling access, I did wanted to mention how a client is linked to your agency. Well, there are two methods. So the first one is automatic linkage. So if a client had a bill service at your agency within the past 9 months, they are automatically going to be linked to your agency. A client is also automatically linked if they are currently enrolled in the health home or care management agency according to DOH MAP. Um, so this is how a client is automatically linked to your agency. Another way a client is linked is through manual linkage. So if a provider attests to one of the following, they are manually linked to the agency. So if a client signed PSYCKES consent form, DOH health home patient information sharing consent, or BHCC consent, they are going to be linked to your agency. If a client has provided verbal consent, or if a provider has attested to a clinical emergency, or if a client is currently being served by or transferred to your agency, they are going to be manually linked to the agency. So now that we know how a client is linked to your agency, let's talk about different levels of access to the client data. I do really want to mention here that consent is required to view the client's clinical summary. So let's start with the signed consent. So this is your PSYCKES consent form, the BHCC, DOH health home consent form. And if a client signs this consent form, it allows you access to all available data for 3 years after the last billed service. Now, when you go into PSYCKES and enable consent or enable access through signed consent, you will be able to drill into the client's clinical summary, and it's also going to include data with special protection such as SUD information, HIV information, family planning information, and genetic testing. And coming down to the verbal consent, so if a client has provided the facility verbal consent, it allows access to their clinical summary, but that data is going to be limited as it's going to exclude data with special protection. So it's not going to include information in regards to SUD, HIV, family planning, and genetic testing. And if a client does provide verbal consent, you are able to access this limited data for 9 months. Now let's talk about clinical emergency. So if a provider attests to a clinical emergency, you are able to view the client's clinical summary, and this allows access to all available data, including data with special protection for 72 hours. And in the next slide, we're actually going to discuss what a clinical summary is, how it's defined, and what are some of the instances where a provider would select this option when enabling access to client data. And then lastly, we have our attestation of service. So this is for clients currently being served by or transferred to your agency. And what this does is that it does link client to your agency for recipient search reports, but it will not provide access to the clinical summary. So the client will show up in this aggregate data that you pull from recipient search or QI reports, but you will not be able to drill into their clinical summary to go over those detailed information. So these are different levels of access to client data, and these are the options that you will see when you go into PSYCKES to when you try to enable access. So I wanted to touch base a little bit on clinical emergencies. So a clinical emergency, if a client refuses or is unable to consent and is having a clinical emergency, the provider is permitted to obtain a psyche's clinical summary without consent. And we often refer to this as breaking the glass scenario. So, the New York State public health law defines clinical emergency as a medical or behavioral condition for which there is an immediate need for treatment and symptoms are sufficient severity that the absence of immediate treatment would likely result in serious harm to self or others. So here we have a few examples of what the breaking the glass situation looks like. And if you have any questions about, attesting to a clinical emergency, or if you have any questions about psyche's consent, please do not hesitate to reach out to our help desk. So going over the examples, so some of the ones that we have available are threats of or attempts at suicide or serious bodily harm or other conduct demonstrating danger to themselves. Another one is homicidal or other violent behavior by which others are placed in reasonable fear of serious physical harm. Inability or refusal due to mental illness to provide for their own essential needs, such as food, clothing, necessary medical care, personal safety, or shelter. And the last example that we have here is overdose, sedation, altered mental status, catatonia, or otherwise non-responsive. So these are some of the examples of breaking the glass scenarios where a provider can go into psyches and attest to a clinical emergency and access the client's data. And please do note that, as mentioned in the previous slide, when a provider attests to a clinical emergency, they are able to view all available data, but you can only do so for 72 hours. After that 72 hours is up, you will not be able to view the clinical summary unless consent is entered. And lastly, I did wanted to point out that providers are responsible for ensuring that the medical record supports emergency access by documenting why or how the client meets the criteria for a clinical emergency and attesting with their signature, date, and time stamp. All right, so in the previous slides, we went over different levels of access, and here we have a nice chart that summarizes the access levels. So in this column, we have client data, agency link type. So we have two types, automatic and manual. We have a column for client data access types, what information that you'll be able to view. Does that level of access include data with special protection? And for how long will you be able to view a client's clinical summary, depending on what type of access is entered. I will not be going over in much details, but just to kind of reiterate, for clinical emergency, you will be able to see all available data for 72 hours. For verbal psyche's consent, you will be able to see the client data, but it's going to be limited as it's not going to include data with special protection, and you can only view that for 9 months. And then the most common one that we have here is the psyche's consent. So that's going to provide you access to all available data, including data with special protection. And of course, you can view that for 3 years based on the last date of last bill date of service. So this is a nice visual representation of some of the different access levels that we have. All right, so we talked about some of the different levels of access and all of the data that's included in Psyche. So how to enable access to client data? Well, there are several ways, so we will be doing a quick run through of different ways that you can enable access to client data in Psyches. So the first one is through recipient search. When you go into Psyches and select recipient search, it's going to show you these two different tabs. So we have the individual search tab and cohort search tab. Here you can search for an individual client using recipient identifiers. So you can search by Medicaid ID or social security number. And if you don't have this information, you can search by first name, last name, and date of birth. You can also apply these characteristics and then you can run an individual search. And then another option is through recipient search, cohort search. Now, here you can perform a group of cohort search. For example, you would like to pull up a report of individuals who are positive for this 4+ inpatient/ER behavioral health reasons. You can apply this filter and run a cohort search, and it will show you how many recipients are positive for this specific quality flag. And here you can see this nice table that shows the name of the client, their gender and age, Medicaid ID, date of birth, race and ethnicity, Medicaid managed care plan, Medicaid quality flags, our planning consideration columns. It shows some of the critical information without having consent. And then we also have our current PHI access column. And as you can see, it currently shows no access, but this enable access shows up in blue hyperlink. So you can select this option to enable access. And that would be through the cohort search option. Another option is through My QI Reports. So we are going to hop on over to My QI Reports tab on this purple banner, and you can go to the quality improvement section. You can apply an indicator set. So for this instance, we have high utilization inpatient/ER selected, and we will further select this 2+ inpatient mental health indicator. And as you keep applying these different sets of filters, it will take you to this unduplicated recipients list. And here you can see a similar information that you saw when we pulled up the recipient search cohort search. And as you can see, we also have this current PHI access column, and it shows no access. And as you can see, you have the enable access in blue hyperlink. So this is another way that you can enable access in PSYCKES. And lastly, we have our registrar menu. So we are going to select registrar menu, and then we are going to select manage PHI access. And here, the first thing that you'll notice is this enable PHI access section, and there's a blue hyperlink that says search and enable access. When you select this option, it will ask you to input the recipient identifiers, and once you enter those information, it will take you to a table that's similar to the ones that we previously saw, where you can select enable access hyperlink. So just to quickly summarize, you can enable access through My QI Reports, recipient search, and the registrar menu. So let's do a quick run through of how you can enable access in PSYCKES. And for this instance, we are going to enable access through recipient search, but more specifically through individual search. So when you log into PSYCKES, go to recipient search and go to individual search tab. You can enter the recipient identifiers. So it can be Medicaid ID or social security number, and you can select individual search. If you do not have these two information, you can of course search by full last name and either date of birth or first name. And you can also input these characteristics filter. So what does that look like in PSYCKES? Here we are in our individual search tab. You can enter Medicaid ID or Social Security right here. And then if you do not have these information, you can also enter first name, last name, and date of birth. And if you'd like to apply these characteristics filters, you also have the option to do so. So once you enter the recipient identifiers, you can select individual search. So once you select search, it's going to take you to this next screen, which will say one recipient found. And then on top, you can see their Medicaid ID, and it will show you this table that we have seen previously. So of course, it's going to show you the name, gender, age, and date of birth. We have the unique identifier. So in this instance, because we entered Medicaid ID, we have that information here, race and ethnicity, address, Medicaid managed care plan, Medicaid quality flags, planning consideration columns, and then we have our current PHI access. Right now, it says no access, and as you can see, the enable access shows up in a blue hyperlink. Another thing that I wanted to mention is that the client's name is not in a blue hyperlink. So once you select Enable Access, the next screen, it will show you the different levels of access that we previously covered. So this is where you will enter, select the checkbox for a client signing PSYCKES consent form, the BHCC consent form, or the DOH Health Home Patient Information Sharing Consent, or you also have the option to select client gave verbal consent. And if it's a clinical emergency, you can attest to that here as well. And then another one is attestation of services. So when you select this option, it will not allow you to view the clinical summary, but it will link client to your agency and they will show up in the aggregate data that you can pull from recipient search or MyQR reports. So in this instance, we are selecting client signed a PSYCKES consent. So once we have that information checked off, we can select next. And if you'd like additional details about different levels of access, you also have this icon that says about access levels, and it's going to give you a detailed information on what these different access types entails. So once we select next, the first thing that we want to do is that we want to double check the unique identifiers, the client's date of birth and address. We want to make sure that when you're entering or whenever we are enabling access, we want to make sure that we are doing so for the right client. So once you have the information confirmed and it is correct, we are going to come down to this provider attestation to client identity. So here you can attest to a client identity, or a client can also provide one photo ID or two forms of photo ID or non-photo ID. So in the first one, if a client has provided a photo ID, you can select from this drop-down as to what type of photo ID that is. But if a client has provided two forms of non-photo ID, you can select from this drop-down as well. So in this instance, we are going to select provider attest to client identity. And as you can see, it will say that Main Street Agency will be given access to all available data for 3 years. And it does let you know that it renews automatically with billed service. So once you have entered this option, we do have an option for enable and view client clinical summary. So when you select enable, it's going to take you back to this table right here, but the current PHR access will say PSYCKES consent, whereas if you select enable and view clinical summary, it will actually directly take you to the clinical summary that you can review. So in this instance, we selected just the enable option. So the first thing that I want to point out is that now the client's name is going to show up in this hyperlink. So when you select on the client's name, it's going to take you to their clinical summary. And then another difference that you may have noticed is that under current PHR access, it shows PSYCKES consent. So you can drill into this clinical summary and view that information. So we have covered what PSYCKES is. We also talked about different levels of access and some of the ways that you can enable access to be able to view the clinical summary. So now we are going to shift gears to discussing the detailed sections of the clinical summary. So what is a clinical summary? What information is included in there? What are some of the information that you can further drill into? So let's start with the clinical summary overview. So our clinical summary, it summarizes up to 5 years of treatment history for a client, and it sort of creates an integrated view from all databases available through PSYCKES. So some examples are hospitalization from Medicaid billing, state PC residential services from state PC EMR. We have health home information from DOH MAP, suicide risk from incident management, AOT court orders from OMH database, homelessness information from DHS and Medicaid, mobile crisis from DOH, MH, Maven. So we have all these data sources that are coming into PSYCKES, and Clinical Summary integrates all of this information in a very user-friendly format. So it summarizes treatment episodes to support rapid review. And all of this information in the clinical summary, you can further drill into it. And for example, if a client has utilized a specific service on a specific day, you can actually select the diagnoses or procedures, and you can actually review the information through date of services. So if you want to take a look at a specific data service, you do have that option in the clinical summary. And our clinical summary is organized by sections like an EMR, so it's easier to follow through, and it divides these sections into digestible chunks as well. All right, so let's take a look at many different sections that we have in the clinical summary. So we have the general section, we have a current care coordination section, the notification section, active Medicaid restrictions, alerts, social determinants of health, quality flags, plans and documents, behavioral health slash medical diagnoses, the integrated view of services over time chart, care coordination, medication information, outpatient services, and that's divided into behavioral and medical, crisis services, hospital slash ER services, dental and vision, living support and residential treatment, laboratory and pathology, radiology. Medical equipment, as well as information on transportation. And in this webinar, we are actually going to cover every single one of these sections momentarily. So once you enable access to a client's client level data, the first thing that you will be shown to is this brief overview. So the PSYCKES clinical summary is divided into two sections. So we have the brief overview and the full summary. Right now we have an example of the brief overview. And another thing that I wanted to mention is that we have all of this information coming into PSYCKES. So when you select this data source link, it will actually tell you some of the data um, that is being fed into PSYCKES, where the data is coming from, and how often it is updated. And you can also export this brief overview in a PDF format. Another thing that I wanted to mention is this data with special protection show and hide toggle. So if you'd like to hide data with special protection, so that includes information related to SUD or HIV or family planning, you do have an option to hide that details as well. I do want to point out that if you entered verbal consent, you will not be shown this option, as when you enter verbal consent, data with special protection is not shown at all. So in the brief overview, as you can see, we have this general section, we have current care coordination section, notification section, alert section, and the purpose of this brief overview is that it includes all these critical details in sort of this one-page document that's easy to access. So for example, if there's a clinical summary and you'd like to review the client's data, if you go to brief overview, you have a lot of these critical data available to you, so it's easier to identify as well as quicker to review as well. So when you select that data source icon, this is the document that will be shown. So here on the right-hand column, you have all these different sections of PSYCKES and the information that's being fed. And in the left-hand column, it's going to show you where that information is coming from. So for example, information related to diagnoses, well, that's coming from New York State Medicaid billing database. And as you can see, it also tells you how frequently this information is updated. So in this instance, it's updated on a weekly basis. And you can also export this and download this in a PDF format, so you can save it to your local file and refer back to it if needed. So as you scroll down to the brief overview, there's a section for alerts, and this is going to include all available data. And then we have our social determinants of health, past year. We have a section for quality, active quality flags. And as you can see, we have this as of date. And then we have our diagnosis posture, and it's divided into two sections. So we have behavioral health and medical health. And as you further scroll down, you also have information on a client's medication history. So you have all these medications, when it was last picked up by, as well as the dosage, the quantity, and all these additional details. And you also have information on outpatient providers, as well as information on hospital and crisis utilizations. So you have the ER visit information, inpatient admissions, as well as crisis services information. So we are still in the brief overview. And as you can see, we have a lot of these critical information sort of condensed into one page so that it's easier to identify as well as quicker to review. And then at the bottom, you can also see the brief overview as of date. And please do note that Clinical Summary is updated on a weekly basis, and you can toggle over to view full summary, or you can also export the brief overview. So let's toggle over to view full summary. So let's start with the very first section that you will see when you toggle over to the full summary, and that is the general section. And it includes information such as the client's name, date of birth, address, phone, Medicaid ID, Medicaid aid category, Medicaid eligibility expiration information, Medicare related information, managed care plan, MC plan assigned PCP information, HARP status, HCBS assessment status. So this is what is included in the general section. So this is what it looks like. So when you toggle over to the full summary, you of course have the option to view the data source document, and it will show you that pop-up window. You do have the option to export it in a PDF file, but for the full summary, you also have an option to export in an Excel file. And you have this information that I previously mentioned where you do have an option to show or hide data with special protection. Another thing that I wanted to mention is this sections, these three horizontal lines. So when you select this three horizontal lines, it will give you a hyperlink to all different sections of the PSYCKES clinical summary. And when you select a specific hyperlink, it will actually directly take you to that section. So for example, let's say I want to view a client's detailed hospital and ER services information, instead of having to scroll all the way down to that section. If you come down to these three horizontal lines, you can select this option, go to the hospital/ER services hyperlink, and it will directly take you to that section. So I just wanted to quickly mention that. So let's talk about the general sections. As you can see, we have the name, the date of birth, the address, Medicaid ID, Medicaid aid category, Medicaid eligibility expiration date, Medicare information, so whether that's usually yes or no, managed care plan, MC plan assigned PCP, HARP status, HARP HCBS assessment status. So once you scroll down a little bit, after the general section, you will come across this current care coordination section. And this is what we call sort of our who do you call section, because it has contact information for a lot of these services that the client is enrolled in. So some examples are New York City jail-based care, New York City Department of Homeless Services, assisted outpatient treatment enrollment, health home enrollment or outreach, assertive community treatment, health home non-Medicaid care management, non-Medicaid care coordination, intensive mobile treatment, housing/residential program, OMH unsuccessful discharge, re-engagement alert, safe support options, care coordination organization, critical time intervention, home-based crisis intervention. So we have all these information that could potentially be shown under current care coordination if a client is enrolled in any of these services. So what does that look like in the PSYCKES clinical summary? So here you can see the current care coordination and all these information right here. So taking an example of the health home. So at the top, you can see the health home that the client is enrolled in, the time frame. So you have the begin date, the end date, the current status, the main contact referral information. So you have the name of the individual, phone number, and email. You also have the member referral number as well as the email. And you also have this downstream um, organization that or the downstream care management agency that the client is enrolled in. And you also have information for New York City Department of Homeless Service shelters. So, of course, you have the name, the date, as well as the shelter director contact information. And as you can see, we have most of the information here. You'll see the name of the service, the facility, and the time frame, as well as the main contact information. So a lot of the times you'll see the name of the individual, the phone number, as well as the email. So this is what our care coordination section looks like in the clinical summary. So let's take a look at the clinical summary notification section, and this is sort of our service eligibility section. So here, if a client, for example, has complex needs, it's going to show up in the notification sections. If a client has Medicaid eligibility alert, it's going to show up in the notification section. Inactive Medicaid alert, prescription prior authorization, Health Home Plus eligibility notice, Health Home Plus services received information, mobile crisis information, on track early psychosis program enrollment information, high fidelity wraparound likely eligible, high mental health need information, OPWDD, NY START eligibility, active registries, core eligibility, assisted outpatient treatment, referral under investigation, mental health placement consideration, as well as any notifications on limited data. So let's see how that looks like in the clinical summary. So as you can see in the notification section, you have all of these service eligibility, and it will tell you why they are eligible for that specific service or additional details. So for example, if a client has complex needs and they are being flagged as complex needs, it will tell you why a client is being flagged for complex needs. As you can see, you have information on prescription prior authorization, and you also have this mobile crisis information. So you have the name of the outreach team, the referral date, the source information, and then presenting problems, provisional diagnoses, and then case-related information. We also have this Health Home Plus eligibility section where it will tell you the client is eligible and they are eligible because of these criteria. And then you also have a section for high mental health need, mental health placement consideration. You have the Medicaid eligibility alert, so it will tell that a client must recertify, and it will tell you to in this specific instance, it is telling the client to recertify through their local county Department of Social Services, and it will provide a hyperlink on how to do so, as well as a link to the local DSS website. And then we also have a section called Core Eligibility within the notification section. So scrolling down, we also have this active Medicaid restriction section. And in this specific section, this is only going to show up if a client has an active Medicaid restriction. So if a client didn't have any restrictions, this section is not going to show up in the clinical summary. So let's take a look at some of the examples of active Medicaid restriction and what it looks like. So in the left-hand column, you can see the restriction type. So taking a look at the first one, we have the clinic restriction and then restriction provider. So you have the begin date, the name of the provider, the address, and the phone number. So some of the examples of restriction type may include clinic related restrictions, pharmacy related restriction, as well as inpatient related restrictions. And then we are going to go scroll down to the alert section. So this is the data coming in from NIMERS as well as Medicaid database, and this is actually going to include all available data. So it will include alerts related to homelessness, suicide attempt, suicide ideation, self-inflicted harm, self-inflicted poisoning, overdose-related alerts, as well as alerts related to positive suicide screening and positive depression screening, the PHQ-9. So let's see what an alert section looks like in the PSYCKES application. So as you can see, the information here, it goes past that 5-year mark. So the alert section is going to include all available data. And as you can see, we have all these different alert types. And in this clinical summary, what you can do is that you can select this detail option right here, and you can actually drill into more information about specific alert types. So for this example, we are going to drill into treatment for suicidal ideation alert type. So once you drill in, it's going to show you this pop-up where it shows all alerts for treatment for suicidal ideation. So it will show you the alert slash incident type, the reporting slash billing provider, reporting slash billing program, date of incident or service, medical classification, as well as source. So it is going to provide details on every single one of these instances, and you also have the option to um, export this in a PDF format or an Excel format. So this is what the drill-in view of the alert section looks like in the clinical summary. Now let's jump into the social determinants of health section. So as you scroll further down, the social determinants of health section includes social and environmental conditions that impact a wide range of health risk and outcomes. Example include education and literacy, upbringing, or social environment. So this is what the social determinants of health section looks like in the full summary. So here you have the social determinants of health, and as you can see, a lot of these are in blue hyperlinks. So as they are in blue hyperlinks, you can actually drill further into it. So I'm going to show you an example of what that looks like. So in this instance, we have drilled into this other specified problems related to primary support group, SDOH. So when you drill in, it will show you the date of service, the service type, service subtype, the provider name, as well as primary, secondary, and quality flag related diagnoses. So in the clinical summary, when you see a blue hyperlink, those hyperlink allow you to drill further in. So when you select and click on those, it will give you a pop-up window where additional details are available. So again, as mentioned previously, you do have the option to download this in a PDF format or an Excel format. All right, so let's go back down to our quality flag section. So as you can see here, we have our quality flags, and then we also have this as of monthly QI report, the as of date, and then the definition section. So when you come across these different quality flags, if you are unsure about what the definition is or how they are calculated. You can select this definitions link and it will show you a pop-up window for all these definitions. You also have the option to toggle between all of this information in a table format or a graph format. So as you can see on the left-hand column, we have all of our indicator sets. And then on the right-hand column, we have specific indicators that are part of this set. So as you can see, a lot of these are in blue hyperlinks. So you can select any of these and you can drill further into that information. All right, so now we are going to jump into PSYCKES registries. So PSYCKES registries, it allows providers to identify and track individuals under their care who are at risk and have clinical concerns. So some examples of PSYCKES registries include suicide care pathway, high risk list, and COVID-19 registry. So when you select this eye icon, it will show you details about what the PSYCKES registry is. And in this specific example, we have the suicide care pathway registry. We have the provider name, when that was added, when it was removed, as well as the designation where you can see additional details. So that is what our PSYCKES registry looks like. Another option that we have in PSYCKES is this plans and documents section. And this is where a provider can upload a specific safety plan or psychiatric advance directives, or they also have an option to create new, and they can fill out our safety plan template as well as the psychiatric advance directive template. We also have our screenings and assessments. So when that is entered, you have the assessment name, when it was entered, who entered it, and you also have this option to drill further into it. And I will be covering the plans and documents sections in more detail shortly. This is an overview of what the plans and documents section looks like in PSYCKES. So as you scroll further down, we also have our diagnosis section. So it is divided into behavioral health diagnoses as well as medical diagnoses. And as you can see, whenever you see a blue hyperlink, you can further drill into it. So you can, when you drill into this information, you can view details such as date of service, service type, service subtype, provider, and other diagnosis related information. So let's drill into one of these diagnoses. So in this instance, we have the schizophrenia selected. So when you further drill into it, now you have all these different rows that will show you date of service, service type, service subtype, provider name, as well as the primary, secondary, and quality flag related diagnoses. And you have all these additional details that you can view. And again, you can download this in a PDF format or an Excel format. All right, so here we have this colorful chart that we call our integrated view of services over time. So here you can have a visual representation of all of these services that the client has utilized over a certain time frame. So for example, if you want to take a look at ACT adult information, when you hover over these little dots, it's going to show you additional information. And one of the purposes of this graph or this chart is that you can identify different patterns and you can discuss this with the client as well. So for example, for inpatient mental health, as you can see, the client has many different dots, but there is also a gap that is being noticed right here. So that's something to bring up to a client. So this is a great chart that provides a visual representation of different services that has been utilized by the client within the specific time frame. And if you'd like to view all of this information in a table format, you can just toggle over to this table format right here. All right, so as we scroll further down into the clinical summary, we have our care coordination section, and it's going to show you the current care coordination as well as the historical information. So in this section, we have the assertive community treatment act information. So you have the first date billed as well as the last date billed. And currently it shows current. And then you also have the number of bills. But as you can see towards the bottom, we have all these different care coordination services that were utilized in the past. So it contains that historical information. And as you can see, when you further drill into this detail, it's going to show you those specific dates of services, and it will provide you additional information. All right, so we also have a section for medications, and it's divided into the controlled substance category, the behavioral health category, as well as the medical category. So here, if you select on this detailed, it will show you the medication category, and you can view that chronological medication list within that section. You also have an option to drill into a specific medication when you select on this detail option right here. So for example, let's drill into one of these medications. So when you drill into it, you will notice that there are two tabs. We have the orders tab and then the trials tab. So for the orders tab, it will display each individual pickup. So you have the pickup date, the brand name, the generic name of the drug class, the strength, quality dispensed, days supply, tabs per day, total daily dose, route, prescriber, and pharmacy. When you toggle over to the trials section, it will display medications that have been continuously picked up within a short period of time, usually 35 to 45 days. So you have the brand name, the generic name, the drug class when the medication was first picked up, and then the estimated end of trial as well as the estimated duration. So as you can see, whenever you see a blue hyperlink, you do have an option to further drill into it, and if you will be often met with these pop-up windows that will show you detailed information. And again, you can of course download this in a PDF and an Excel format. All right, so we also have the option to view this clinical summary medication section in a graph format. And this is a very useful format. For example, here you can see a specific medication and see the pattern. So for example, a client was taking this medication starting this specific date, but as you can see, there was a gap right here. So that is something that can be discussed with the client, and it can help with the clinical review. So this information can also be formatted in a table. So you do have the option to toggle over as well. And another good feature that we have within this medication section is that when you go to drug name, as you can see, another hyperlink that we have here, when you select this blue hyperlink, it will show you this pop-up window of micromedics. And what it does is that you can view clinical information related to the specific drug. So we have one selected right here. So when you select this, it's going to include, what the medication is, when it's going to be used, the specific dosage, and all these other information. So when you select this drug name, you can view additional information on that specific drug. So now let's go into our outpatient services, more specifically the behavioral health services section. So as you can see, we have the service type. So an example is clinic substance use specialty, the provider name, the first date billed, the last date billed, a number of visits, most recent primary diagnoses, procedures the last 3 months. So this is sort of what we consider a summary table, but as you can see, you can further drill into this information. So when you drill into it, it's going to show you additional rows where the information is divided based on the date of service. So each date of service is going to have a separate row. So you can view that information based on that date. So as you can see, we have the service type, the provider, the primary, secondary, and quality flag diagnoses, the procedures, as well as the practitioner information. And going to our medical outpatient services, it's a similar format that we saw in the previous slide where we had the service information, sort of this summary table. And then when you further drill into it, you have the date of service, again, service type, provider, the diagnosis related information, as well as the procedure. So again, you can further drill into these services and view detailed information. And then we also have our outpatient services, especially this details section. And if you'd like to just get a list of every single behavioral health services, but in that drill in view, when you select this detail option, it's going to show you all behavioral health services, and you can also download in a PDF format or an Excel format. And now we are going to come down to our crisis services section. So we have our service type, we have our provider, the admission / date of service, discharge / date of service, number of visits / length of stay, most recent primary diagnoses, and most recent procedures. Again, when you further drill into it, it's going to show you more details on the specific crisis services. And here we have our hospital information. So you have the hospital service type, the name of the hospital, the admissions date, as well as the length of stay, most recent primary diagnoses, as well as procedures per visit. And again, as you can see, you can further drill into it, and it's going to show you every single date of service from the specific provider. And you can also format this information in either the table format or the graph format. And additional information that you can see in PSYCKES is dental information, vision information, as well as living support / residential treatment information. So you have all these additional information such as service type, provider, most recent procedures, and again, you can further drill into it. So that is another section that we have in PSYCKES. And coming down to our laboratory and pathology, we also have that information. So you have the test / panel name, the number of tests, and the most recent lab / pathology provider. And if the laboratory results are coming in from state PC, we have the test name, the most recent test panel, as well as the test results located right here. And you can, of course, further drill into to view detailed information. And the same thing goes for radiology section, where you can further drill into it. And again, you can format based on table format or graph format. All right, so we also have information on medical equipment as well as transportation. So you can, again, further drill into it to look for additional information that you may be interested in. So those were a lot of the clinical summaries that we just covered. So one last thing that I wanted to mention was that you can export the clinical summary from PSYCKES. And when you select export, so either the PDF or the Excel version, in this instance, we have selected the PDF option. You do have an option to include a brief overview as a cover page. So you have that option available. And then for export options available, you have the options to export every single section summary data. So it's only going to include those summary tables, but it's not going to include those drill-in sections. So if you want to include those drilled-in sections as well, that's going to show you every single date of service and information related to that. You can select selected sections, all available data. And then we also have the page orientation. So we have the portrait as well as the landscape. And then you have all these sections available, and you can hit export and you can download it in a PDF format or an Excel format. So another thing that I wanted to mention is the non-Medicaid clinical summary. So what is a non-Medicaid clinical summary? It was basically added for clients who are not in the Medicaid population, and they have either been served by a state-operated psychiatric center or have been served by a provider agency utilizing the PSYCKES My Choice application. Just like the Medicaid clinical summary, verbal or signed PSYCKES consent form is required to access a clinical summary for a non-Medicaid client. And because it's a non-Medicaid client, instead of using Medicaid ID, you can actually search for an individual using their name and date of birth or social security number. And users, PSYCKES user from State Psychiatric Center, they have an option to search using the OMH state ID or OMH facility case number. And if the client has a clinical summary available in PSYCKES, there's potential for one or more matches that will appear in the results page. So just a heads up to confirm and double check the information before enabling access in the clinical summary. And then for non-Medicaid clinical summary, what are some of the data sources that we have? So we have the general demographic information, current care coordination information, alerts and incidents, PSYCKES registries, plans and documents, screenings and assessments, diagnosis, behavioral health and medical, medication, behavioral health and medical, behavioral health services, hospital and / ER services, living support and residential treatment. So as you can see, for a lot of these, it will say OMH state PC data, or it will say PSYCKES My Choice. As you can see, because it's a non-Medicaid clinical summary, the information is not really coming from the Medicaid billing database. We have these other data sources that it's coming from. So let's take a look at what our non-Medicaid clinical summary looks like. So as you can see, the top section is quite similar in the sense that you have the as of date, you have the data source, but as you can see, it also says that there is no record of Medicaid enrollment, and it will tell you that it is a non-Medicaid summary. So in the general section, you have name, date of birth, and address. Of course, you have the unique identifiers such as OMH state ID, case number, and My Choice ID. Notification information, alert section, plans and documents, behavioral health diagnoses, medical diagnoses. So these are some of the information that is being pulled into this non-Medicaid clinical summary. All right, so I briefly wanted to mention this plans and documents section. So providers do have the option to upload some of the following documents in the plans and documents section of the clinical summary. So you have the option to upload safety plan, relapse prevention plan, psychiatric advance directive, care plans, discharge plans, and any other additional documents. So you have the option to create a new document where you can select this option and you can fill out an existing safety plan or psychiatric advance directed template, and you can save it to the client's clinical summary. But you also have an option to upload another safety plan. And I did wanted to mention that the uploaded or newly created document, it will be accessible to users at the agency responsible for uploading and creating it. But if other agencies want to view this information, they will need assigned consent or in a clinical emergency. That's when they will be able to view this information. So let's see what the process looks like. So the first one is if you want to upload a safety plan into the clinical summary. So when you select upload, it's going to show you this pop-up window where you can select the type of document. And as in this instance, we have safety plan created, we have the date of the document, who it was created by and their role. And then the document source here we have is the document, and then you can just click upload. And as you can see, it will show you when the document was created, what type of document it is, the provider name, as well as these additional details. And there is an option to delete the document if needed as well. And then if you'd like to create a new document, you can select this option and you can select out of these two. So if you want to upload or if you want to create a new safety plan or psychiatric advance directive, you can select this option. So if you want to create a new safety plan, you can fill out this information and click submit. And when you do so, again, it will show up in the client's clinical summary as shown in the screenshot right here. So that captures basically our entire clinical summary and all of the sections that we have available. But before we end today's webinar, I did wanted to provide some additional resources and training materials, as well as our PSYCKES help desk information if you have any questions. So before we get into the resources, I did wanted to mention that now that you know what PSYCKES is and what are some of the sections that are available in the clinical summary, if there are any specific features, any specific requests that you have that may be useful for you and the work that you do, please feel free to send that request to our PSYCKES help desk at psyches-help@omh.ny.gov. You can include the description of the feature that you'd like to be added, sort of purpose of the new feature would serve, as well as how this feature could help a larger group of users. So we always appreciate user feedback. So if you have any feedback, you can provide us to our PSYCKES help desk. And as for the training materials, we have many PSYCKES resources listed in our PSYCKES public website. For example, we have the webinar, so we have the PSYCKES training webinars where we cover PSYCKES in much more great detail, and also it's sort of divided into role-based, feature-related, access-related, as well as release overview sections. We also have PSYCKES user guides. So the way that our user guide is set up is that each user guide is sort of a specific section of the PSYCKES application. So for example, if you just want to take a look at the user guide for clinical summary, you do have an option to do that as well. And as for short how-to videos, you can find short trainings for using self-service console and managing your token, as well as how you can view the clinical summary. And all of this can be found in our PSYCKES public website. And then lastly, we have our technical support information. So if you have any questions regarding the PSYCKES application, please do not hesitate to reach out to our help desk. Our help desk is open from 9 a.m. to 5 p.m. Monday to Friday, and our email is psyches-help@omh.ny.gov. But if you are having issues with your token or login issues, feel free to contact ITS or OMH Help Desk. I'm going to put the slide up, but I did wanted to check in and see if there were any questions that came in that we can address on air.
Hi, Ashma. We had a few questions come in. The first is going to be, I'm seeing the wrong diagnosis for a service my client received in PSYCKES. How can I go about fixing that?
That is a great question. Thank you so much for bringing this question up. So because the data is coming from the Medicaid billing databases, we at OMH, we do not have the process ourselves to make corrections. So what we recommend is that you contact the provider who accidentally may have added the incorrect diagnoses. So once you contact them and it is rectified on their end, Medicaid database is going to pick up that information and it's going to be eventually reflected in our system. So I highly recommend that if you are seeing an incorrect diagnosis, to reach out to the provider. But of course, if you have a very specific question, about the diagnoses, you can also reach out to our help desk and we can provide further assistance. But that was a really great question. Thank you for asking. Any other questions that have come in?
We just have one more. So the question is, I noticed the client is listed in the recipients tab for a quality flag in my QI report, but when I go to their clinical summary, the flag is not included in the quality flag section. Why is that?
That is a great question. So, a quality flags are updated on a monthly basis. So, for example, a client could have an active quality flag uh, for a specific month, but if they no longer meet the criteria for that specific flag, it sort of dropped off from the clinical summary. So if you'd like to take a look at some of the technical specifications of, what are some of the criterias and why a client would be included in that QI reports, please feel free to refer to our technical specifications document up on our public website. But again, if you have any specific questions, please feel free to reach out to our PSYCKES help desk. And thank you for your question and any additional questions that have come in.
There are no more questions. Thanks, Ashma.
Okay, thank you so much, Cameron, and thank you to all of you for attending this PSYCKES training webinar. We hope that this was helpful and hopefully that it was helpful to review the clinical summary. And again, if you have any questions, please feel free to reach out to our help desk. Thank you, everyone, and hope you all have a wonderful rest of your day.